Welcome to Healthcare Reform Demystified. Today's episode, Why Healthcare Reform Matters. The Patient Protection and Affordable Care Act, commonly referred to as healthcare reform, has more pages than a New York City phone book. Its impact on the healthcare industry, employers, and individuals is just beginning to be felt, and many of its provisions won't take effect until 2014. All the same, no recent act of government has inspired more conversation or controversy. Some think the Affordable Care Act is just what the country needs. Some think it goes too far in requiring people to have health care coverage, while others think it doesn't go nearly far enough in providing coverage for those at risk of falling through the cracks. I'm not here to convince you one way or the other, but I would like to talk about why the idea of health reform and the specifics of the Affordable Care Act matter to you. So, let's start with the basics. How did we get here? The biggest issue driving the healthcare debate is our old friend, money. Healthcare costs are growing and fast. How fast? Faster than the rate of inflation, which is never good news. And while people on both sides of the issue will quibble about why costs are on the rise, they agree that something has to be done to get them under control. Issue number 2 is money's second cousin, access. As costs increase, more Americans are getting left out of the healthcare system altogether. When the health reform law was passed in 2010, it was estimated that nearly 50 million Americans did not have health insurance. Some people could be denied health coverage due to pre-existing health conditions. Some plans had lifetime or annual dollar limits on benefits, which could leave people without healthcare coverage at the time they need it most. On the employer side, businesses saw their premiums go up if their employees got sick or injured, making insurance coverage more difficult to afford. Altogether, it was estimated that 1 in 6 Americans had no health insurance. So now that we've got an idea of the challenges that prompted healthcare reform, let's take a look at some of the things the Affordable Care Act does to address them. Some of the first changes made under the law are the elimination of coverage rescissions, except in the case of fraud, the end of pre-existing condition limitations for children under 19, and the elimination of lifetime and annual limits on coverage. Check out my video on lifetime and annual limits for more information on these changes. The law requires each state to establish a health benefit exchange by January 1st, 2014. This is intended to create a competitive marketplace for Americans shopping for health insurance. Insurers must spend a certain percentage of premium dollars on healthcare services like paying claims and improving healthcare quality. The percentage that insurers spend on healthcare, in contrast to the percentage spent on administrative services, is called the medical loss ratio. Insurers are required to maintain medical loss ratios of 80% for small group or individual plans and 85% for large group plans. Some small business owners may get tax breaks to help make offering health coverage to their employees more affordable. If you are a small business with fewer than 25 full-time workers, check out the Small Business Tax Credit video to see if you are eligible for this credit. Beyond that, health plan members may also enjoy new benefits. Certain important preventive services are now available without co-pays, co-insurance, or deductibles. I delve a little deeper into this in the video called Preventive Services. Also, health plans that provide coverage for dependents are now required to cover adult children until they reach age 26. See the video called Dependent Coverage for more on that. And if your plan denies coverage for a procedure or service that you believe should be covered, you have the right to appeal that decision. To learn more about this, take a gander at the Appeals video. Finally, if you have a flexible spending account, health reimbursement account, or health savings account, You'll want to take in the video on how the Affordable Care Act affects those accounts. I simply could not conclude without reminding you that there are exceptions to every rule, and the Affordable Care Act is no exception. Not all provisions of the law apply to self-funded plans, and plans in effect as of March 23, 2010 may be considered grandfathered and therefore exempt from some provisions of the health reform law. You can learn more in my video about grandfathered plans. The Affordable Care Act is a remarkably large and complex piece of legislation. I've taken a shot at simplifying some of the most important elements of the new law in a series of videos like this one, and new videos will be added to help make sense of other provisions in the future. And on that note, it's time for me to hit the books again. Wish me luck. You can find more answers to questions about the Affordable Care Act on the United for Reform website. And as always, contact your broker or a United Healthcare representative with any questions about your plan.